You wake up with a headache, you swallow a pill. You scrape your knee, you dab on some antibiotic cream, you get a fever, you go to a doctor. Now strip all of that away. Imagine a world where a broken tooth is a ticking time bomb, where childbirth is a coin toss with death. For 99% of human history, there were no hospitals, there were no pharmacies, there was just us, the wilderness, and a desperate will to survive. We look back at Stone Age humans and picture primitive brutes banging rocks together. But the idea that ancient humans just dropped dead at age 30 is a statistical lie caused by brutal infant mortality. If you actually survived childhood, you routinely lived into your 60s and 70s, becoming a vital elder who held the tribe's survival secrets. They weren't frail. They were built like Olympic athletes with bone density significantly higher than ours. They walked or ran miles every single day, lean, strong, and highly adapted. But no matter how strong you are, the wild eventually comes to collect. You could have the stamina of a wolf and the strength of a silverback, but a tiny cut from a dirty rock could still rot your leg off and kill you. So how did they survive? Without microscopes, without germ theory, how did they know how to heal? At first they didn't. They had no concept of bacteria or viruses. They thought sickness was caused by angry spirits, dark curses from rival groups, or just bad air. When someone fell desperately ill, you didn't call a physician, you called the shaman. They would perform wild, exhausting dances around the fire to scare the sickness out. But beneath these chaotic rituals, human medicine was silently evolving in three distinct, savage phases. Phase 1 was observation. For almost all of human history, our entire existence revolved around one brutal objective: finding calories before something else made calories out of you. Survival meant tracking prey. And when you spend your entire life watching animals, you develop a superpower of pure, savage observation. They watched bears chew on specific roots when they were sluggish. They watched chimpanzees swallow rough leaves whole to clear out parasites. They watched wild elephants pack thick mud into open cuts to seal out flesh-eating flies. They even watched monkeys rub toxic millipedes over their fur to act as a living bug repellent. They saw animals treating themselves in the wild, and they started copying them. Modern science actually has a name for this. It is called zoopharmacognosy. It is the practice of observing how animals self-medicate and then stealing their secrets to survive. But eventually, they encountered new, mysterious sicknesses that animals didn't get. Fevers, internal pain, deep infections. This forced them into phase 2, the brutal experiment. They started applying new things, testing random roots, unknown plants, and weird fungus. There were no clinical trials. Testing a new plant was a literal game of life and death. If a shaman crushed a new leaf and the fever actually vanished, it was a miracle. That cure became tribal law, and the knowledge spread through generations. But if a patient drank a boiled root and died in agony, that news spread just as fast, becoming a dark warning. Every single natural cure we know about today was paid for with the lives of people who guessed wrong, and we have absolute proof that this ruthless method worked. In 1991, hikers in the Alps found a frozen, mummified body. They called him Otzi. He died over 5,000 years ago. When scientists examined his gear, they found a prehistoric first aid kit. Otzi was carrying pieces of a specific mushroom called the birch polypore. It tastes incredibly bitter and has zero nutritional value. So why carry it? Because modern science confirmed it contains natural antibiotic and anti-parasitic properties. Otzi had intestinal parasites, and his people's ruthless trial and error taught him that chewing this leathery fungus made the pain go away. Through this brutal testing, they became the first chemists. If someone had joint pain, they stripped the bark off a willow tree, crushed it, and boiled it with hot stones to drink the bitter tea. Thousands of years later, we isolated the active ingredient in willow bark, salicylic acid. You know it as aspirin. They packed cuts with honey to suffocate bacteria. They used sphagnum moss, which is insanely absorbent and naturally acidic, as the perfect prehistoric bandage. Roots and moss are great for fevers and cuts, but phase 3 is where it gets hardcore. What happens when the sickness isn't a fever, but physical trauma to the brain? Imagine you take a club to the head during a hunt. Your skull is fractured. Your brain is swelling. You start having seizures. Prehistoric humans didn't understand neurology or brain pressure. They thought an angry, evil spirit was trapped inside your head, violently trying to claw its way out. So they gave the spirit an exit. It is a process called trepanation. Archaeologists have found thousands of skulls worldwide with perfectly circular holes scraped into them using sharpened flint. No anesthesia, no sterile room, just a shaman, a sharp rock, and the absolute necessity to cut a hole in your skull to let the demon out. And the most mind-blowing part, the bone around the edges of those holes is smooth. That means the patient survived. They lived for years after having their skulls manually opened with a stone tool. We look at our modern world and think we've mastered life. We think of ancient humans as primitive, but they weren't lesser. They were the pioneers. They walked into a dark, unknown wilderness, bleeding and sick, and played a deadly game of trial and error with nature itself. Every medical breakthrough we have today stands on the shoulders of an ancient human who was brave enough to observe, test, and survive. They didn't have modern medicine, they just had the raw, unyielding drive to keep going.